Welcome to All Things Africa, the podcast. Listen in as Levy, Mike, and Linda discuss socio-political and economic current events and how they affect Africans worldwide. You know, your experiences here in the U.S. make me really realize, to the extent that the rest of us who are not in the health field and coming into contact with people every day who are sick with COVID, how much more, we have a real issue. It's because for us, we don't have to come into contact with people. We just hear the numbers on the news and we think about, I'm going to have to avoid going to these places with my kids, or I need to make sure that I don't go to this place or that place. But for you and your family, you're constantly having to deal with this. So thank you for your perspective. I'd love to hear what you have to say, considering people back home in Kenya. As a pastor and as a nurse, what do you say to that pastor, to that nurse, or even to a regular citizen who doesn't think that COVID's a big deal, or, how these measures that we're taking of social distancing, they're too hard to follow, or to wear a mask in public and those things. What are your thoughts? And based upon your experiences, what would you say to these individuals, or, specifically to a nurse, to a pastor who's struggling with their congregation not being able to come back together?
To a nurse, I would say they have to find a coping skill. They have to have a good family relationship. And that's the advantage of Kenya, because Kenya family is not just the one you live with in the house. Family is broad, and family is even your neighbor. Because I remember when I was here, when it first started, I have a Covenant family, some in Canada, some in the US, and they all were worried. They always called, they always checked, they always said, "Are you okay?" They always said, "Reduce the number of hours," because I worked longer hours than I did ever in my nursing career during this COVID-19. And I think that was one of the therapies that kind of helped, because when you hear all these family members calling you and checking on you, especially the Covenant parents I have in Canada, they would constantly check on me and make sure I'm fine. And they would even tell me, "I think you need to take days off and not even work, turn your phone off and don't even take extra shifts." That was a good coping skill that helped even at that time. Having to know that people care, people love you, your co-workers, your church members, your other fellow pastors. And in Kenya, this is very rich. And I think this is one of the ways that they can deal with connecting with family members. The long hours of work, you just have to think of how you're going to unwind. Lack of PPE, being innovative. I remember having to wear a plastic bag over my face. And when I told my Covenant parent in Canada, they were in shock. I said, there was not enough PPE on this day and I had to go take care of these clients. What would I do other than think of a plastic bag? I just took a garbage bag and I put it over my head and just left a small space for breathing, and I put it in my hands and figured, this is going to work. I figured it was not the time to start. I would complain later, but at that time I had to be innovative. So just being innovative in another way helps it. The stigma you get, finding ways to deal with stigma, because you're stigmatized. Long ago, I would wear my scrubs and go to the store. Nobody cared. I just walked in and shopped and it was fine. Nowadays, I cannot even go to the store with my scrubs. I have to go home and make sure I'm not in my scrubs, because when they see you, there are those who will appreciate you and they will salute you and say, "Thank you very much for the job." There are those who want to attack you. Some died even in Mexico. They were attacked. They were beaten. They were abused because they said, "You're going to kill us. You're carrying the virus. You're all over here." They have forgotten the fact that you are a frontline. You're saving lives. Now they're looking at you as a disease. Just being around you, you're going to kill us. So the stigma, you have to be able to deal with the stigma, because I know in Kenya, people are not believing that this is real. This thing is so real. It is super, super real. I cannot even say how real it is. Um, I had a, I take care of client. I have a private client who's a kid. He's 13, 14 years old. He's got an underlying condition, big time. He can't breathe well. He's always on oxygen. He's got so many things going on in his life. So this is a private job that I go to. He has a dad, well educated, who knows everything about life, who I don't even know how to describe him. But one of the things that his dad, his own father, would never believe in is wearing a mask. And I thought, wait a minute, you don't believe in wearing a mask. When rules were put in by Costco, which is one of the biggest stores here, he said, I cannot wear a mask and I'm boycotting going to that store. He said, period. And I thought, your kid is sick. He could die anytime. If I have it, he's going to die. And you don't believe in a mask. This thing is so real. It didn't take long before he contracted the COVID. It didn't take long before we were told we can't walk anywhere with him anymore. Currently, I cannot go to his house because he was positive. He became careless. He went to parties. He traveled to a state where the rate went up. He came back. He never told us he was exposed. He kept it to himself until his friend called him and said, hey, look, I'm positive. Then he got it. He became positive. After he became positive, now he had to tell us. And now here we are panicking. We are fearful. We are like, now what? Why didn't you say? And all these things in your mind, and you start thinking the children, the family, the church, everybody that you have been around contracted it. What are we going to do? And we just said, okay, we have to go. The kid was taken away from him and shipped somewhere else. He had to be in quarantine. We have to be in quarantine. But because I'm a frontline worker, they say, guess what? You can still go to your other job. Just put on your PPE. That is how much they cannot even afford to let us rest. He didn't believe it. He got it.
Are you saying that you are technically under quarantine, but still having to work?
Technically from one of the jobs, yes.
Okay.
From the kid.
Yeah.
From the kid, I'm on quarantine. I cannot go to that house until his dad test negative again. The kid was taken away, but they said you still have to go to work because you're a frontline worker and you're asymptomatic. I'm not coughing. I don't have fever. I don't have body aches. I don't have all these symptoms. So we are one of the people they could consider asymptomatic. And today is when I'm supposed to be getting my results back, because I had tested 3 weeks ago and it was negative. And now 3 weeks later, we faced it with this situation. But the guy got it. And I cannot say, this thing is so real. You cannot believe how many people. Think about the church. There was a church here that the pastor said, no, everybody just come to church. Don't believe in this. This is not right. God is going to save us. Come to church. It didn't take long. The same pastor who was calling people to church died. And not only him, with other members, he died. Friends that I know who have contracted, my other co-worker that we work with in this other job, she tested positive. One other co-worker tested negative. We are 3 nurses. We rotate around each other, day, evening, and night. I'm the day, there's an evening, and there's a night. The evening tested negative. Our manager tested negative. The father tested positive. The night nurse tested positive. I guess because she spent so much time with the father, because for us, the father is never home. She's sick currently. She's out of work, no pay. Her kids are already sick. Her husband is sick right now. This thing is so real. It is so real. Wear your mask. Put on your clothing. I can never tell people enough how much. It is not about you. If you don't care about your neighbor, care about the other person, care about the other child, care about the grandma, care about somebody around you. That's the person we are asking you to wear the mask for, not you. It's fine if you don't want to wear it. And it sickens me when I hear some people come up with lawyers thinking of a way of making money. And the other day, yesterday, I'm reading an article, an ad that is coming on my phone saying that if you feel like you have been forced to wear a mask, contact me. And I'm thinking somebody's already thinking of a way of making money out of it, and somebody else is dying. Yet in the past, you cannot smoke in a store. Why can we not wear a mask in a store? Yet people cannot smoke. We cannot go in the store and start smoking. It is illegal. It is not allowed. People are complying to that rule. What is wrong with just wearing a mask and shopping for 20 minutes and leaving the store? It is so real. In Kenya, I can tell you, do not think of it as a as a stigma or as a white disease, because many people are dying in the white country and more than in the black countries. Don't think of it that way. Don't look at it like a white disease. It is real. And I know in Kenya, some people have it and they don't know it because of the way life is in Kenya. People might think it's a cold. Somebody might just think I'm just having malaria and not care to wear a mask. It is real in Kenya. It is real.
So recently, as maybe you know now, the churches in Kenya are allowed to resume, or the houses of worship have been allowed to resume. And the condition is that they have to follow health guidelines for the COVID-19 response. Especially, I think the idea is that they're required to form a COVID-19 response committee to oversee the health guidelines. I think the numbers have been limited to about 100 for each church. So they are planning to resume soon. So you have been a pastor, but also you're a pastor, but also you're a nurse. And I think one of the things that the pastors in Kenya are worried about is just risk, right? So they are planning to follow all the guidelines. They have committed to all the guidelines, and they have told the congregation all the guidelines will be followed. But you, being a pastor in your church and being a nurse, obviously there are some risks that you watch out for. What are some risks that you would say a church that's resuming should watch out for? Because, you know, you could have all these guidelines and you could follow them very closely, but sometimes the risks are, you know, are lurking out there in the corner. You don't see them. You could follow all the guidelines, but then you overlook something small. Like in the case of South Korea, where you had one patient who went to a religious gathering and affected 1,000 other people in the religious gathering. And maybe there was just something they overlooked because South Korea has been known to be very careful with COVID. So what are some risks, things that are obviously not visible and easy to see or easy to catch, that a pastor who forms a COVID-19 response committee should watch out for?
So one of the risk factors in opening a church, because I remember when we started going back, we have only gone back to church a quarter of us. We are an intimate church, small church, and we have been able to go back just partially. And from the way I know Kenyans and also Africans, we are very social. We are loving. We believe in close contact. We don't have this spacing like they have it here. So one of the risk factors that I know that I could foresee happening in churches when I heard that they're opening churches is the fact that they are not going to be able to keep people apart. Because when we meet, if I have not seen you even for a week, the first thing I want to do is shake your hand. The first thing I want to do is hug you. When I see your little ones, I want to hug them. I want to carry them and pick them up. I want to talk to them. And so they are not going to be able to keep their hugs apart. They are not going to be able to keep their handshakes apart. They are not going to be able to keep 4 or 5 people sitting around and talking to each other, because that is just part of our culture. That is just part of what makes our society, our culture so rich. The fact that we love spending time together. We love each other. We want to fellowship after church. We want to gather and see how things are doing. Even when we are not talking anything of significance in Africa, in churches, we love to just be around each other. So that's a big risk that the churches are going to be facing, because when you think of a gathering, when you think of people done with church and now sitting together in different small groups, they'll be spreading the disease. And now we don't even have those things like contact traces that we have here in America, or people being faithful enough to say, I was exposed and I think I talked to so and so and so and so, and these are the numbers. We don't even have a system in place that is going to be able to track these people. When they're sitting in church together, even though they say social distancing, I have seen it even in our own, you just forget, because for years, all you have known is let's be close to each other. For years and years and years, 50, 60, 70 years, trying to switch the mind and shift it to a position where you're telling it, don't be close to so and so. It is just so hard. It is just so hard. So the risk will be, how are they going to be washing their hands? Do they have tap water everywhere? Do they have sanitizers, because we have sanitizers at the door. We have wipes, because we are in a society where these things are available. We can go to the store, grab them, and put them at the entrance and educate people and educate them via the phones. And there's education on TV and media and pamphlets and name it. All that is readily available. But I think of a church in Africa. I think of a church in Kibra. I think of a church in the village. I'm thinking, who is going to give them a sanitizer? Who's going to give them a wipe? Who's going to sanitize their mics? Who's going to sanitize their chairs? Who's going to clean after that? They are not going to wash their hands. Half the time they left the house, they didn't even have water to drink, leave alone water to wash their hands. They're coming with it. They shake hands with this one. They shake hands with this one. That is going to be such a risky place to do in the church. The church is going to be facing a lot of challenges with that, having to deal with big churches like those that have 1,000 members. How are you going to put a structure in place that you break these members and break these people and have a management system where this group is managed by this and this group is managed by this and this group is managed by this, ensuring that they wash their hands, ensuring they sanitize, ensuring they sign and say that they came here at will. They're going to be facing so many challenges reopening. Another challenge they might face is some are just not going to be willing to go back to church. Some pastors are just not going to be willing to be a part of the problem, because it's going to arise. The problem is going to be arise. They're going to be having a lot of asymptomatic cases. They're going to be having many people who are not just going to be willing to wear masks. In Kenya, some will just feel like, I can't afford it. What do? I just want to go to church. So the pastors are at a very, very tough spot right now, having to ensure that they bring the members back, but yet be not the one who is the reason why they got sick. Because someone falling sick will just say, I got it in church, even though they probably got it in the market, even though they probably got it from a friend. They will just say, because the church is open and there was 1,000 people and I think I got it from there. And lo and behold, some people might decide not to go back to that church again.
So, Evelyne, you've been going through this as a nurse. You've been going through this as a parent. You've been going through this as a pastor, and in different dimensions of all of those things. A family member, worried about others, a friend, all those things, a sister. How has this changed your view about people, community, the world, the medical profession? How has it influenced your view of things? You're sitting down with your son and you're giving him advice, something you've learned about life or people or communities. What are you saying? What are the things you would, say you've learned?
Every day was a teaching experience at work. Each and every day was a teaching experience, because you meet different families, you meet different clients, you meet different challenges. It has changed my view in many perspectives. One of them is being able to self-manage myself, being able to be my own manager, being able to be over different, thinking out of the box, being able to understand that when you pick a career, you have picked it and you have to go all the way, being able to know that you're a fighter as much as the patients are fighters, being able to know that you are an educator, not only for yourself, but also for the family. It has helped me learn that even the family members go through challenges, because family members at my jobs cannot visit their parents and their loved ones anymore. It has taught me the power of family. It has taught me the power of making use of the time you have with family members far, not only your wife, those who are married, not only your children, not only those that you call family, but siblings and anybody that you call a family. Currently, the law has put it that they cannot visit their loved ones. in this other setting. It's kind of like a rehab center, like a mini hospital. If they have to visit their family members, they talk to them through the window. Imagine you having to come and visit me and I'm sick, but you cannot visit me, you cannot touch me, you cannot talk to me. We can only talk through the window. Time is important. Time is priceless. The time that they have been spending with their family members has been disconnected. Now they have to talk through the window. In the past, now we call them window visits. If you want to visit your family, you call and say, I want to have a window visit. Window visit means you're going to come to the window. We're going to close all the windows. You are not going to be able, you're not going to breathe. We don't want you to breathe inside of the inside of the room unless you wear a mask. You talk to them. Half of them cannot even hear. I cannot even hear them sometimes through the window. And that is the only way that now they can communicate with their loved ones. FaceTiming. Technology is so important. I have learned the power of technology. I had to learn how to use Zoom. I had to learn how to use FaceTime, because this is the only way that people are able to communicate. Even up to now. They make appointments to use the one iPad or the two iPads that we have at our job to be able to see their family members. It has taught me even how to teach my coworkers, especially my African coworkers. It's interesting that they were the hardest to deal with than the white ones. The ones who contracted the virus from our job were more so the Caucasian ones, because you know their culture. Those of you who've met them, they attempt, they think out of the box, they just go, they're risk takers. They can risk their lives. And those that tested positive in the other job were the white ones, because they went to this client. Some of them just went, they never cared. They just walked in and thought, okay, oh, that person has COVID. Okay, let me go say hi to them. So one of the things I tell them is, yes, you can take a risk, but just dress up. It does not matter that you're a risk taker, but dress up. I became more of a teacher even at my job than more of a nurse. I educated each and every day. I educate them each and every day. I go an extra mile. For the children at home, I had to teach them each and every day. I had to check the symptoms every day. They even get upset, because yesterday my son was coughing, and I told him, do you have a fever? Do you have a sore throat? And he got upset because he thought, and all he said, I don't have COVID, because he's already thinking, I know in your mind you're already thinking I'm contagious. And what I read from him was he was probably thinking, I'm thinking he's contagious, because you have to limit their movement. So I have learned that the power of teaching. I've learned the power of thinking out of the box. I have learned the power of risk taking, yet at the same time being careful. I have learned how to manage myself, coping skills that have helped me to work an extra mile. I have learned the power of family. I have learned how life can end in a day. You can be talking to somebody today, tomorrow you come back, they tell you you're not there anymore. I have learned the importance of taking breaks, because you working does not help. You need a break. I have learned stress management, anxiety, depression. I have learned how Africa and America are suddenly on two different worlds when it comes to healthcare. Because I know the healthcare system in Kenya and I know the healthcare system in the developing countries are different. I have learned a lot of that.
So one of the programs that the government has started in Kenya is this community program, where patients who have been affected can be taken care of in their communities. And I think that's to release the pressure from hospitals because of beds that are short. And so you have to see communities taking care. I'm wondering if you are, imagine you are in a community and you are part of that community, maybe like an estate or something like that, and you as the community members had to come up with a plan for how you would deal with any cases that emerge in the community. Just briefly, how would you sort of work with a community in Kenya to figure out how to deal with cases when they emerge in the community? Since this is a plan that the government hopes the communities can be able to figure out, which is a good idea. It's just the issue here is to think about how to prepare communities effectively for this.
So this is a good question because part of the things that I've always wanted to do for many years in my career of nursing is being able to change, being able to be a part of changing the healthcare system in Kenya, or being able to bring the inputs or the education, the experience that I have from the Western world to bring it back home to Africa. I have wanted it so bad because I've understood how the healthcare system works in Kenya. I have seen it, I've experienced it, and I have seen where we need to make a little bit of change here and there. It's been so much my desire to do this because I feel like if we do a little bit of changes here and there, it can work. Now, when it comes to community working or the government of Kenya, part of the organization that I founded and started with other co-workers called Systems Acumen for Community Health Interventions is one of the things that I want to come and implement in Kenya because it's one of those that work with communities in designing systemic interventions for complex health problems. So when it comes to Kenya right now, they probably need something like this. They need something of systemic interventions dealing with complex health problems. And most of the complex health problems are as basic as community problems. So we've been trying to develop project and policy considerations for community health problems. So things that I've seen working here in America and that I can see might work in Kenya is just starting as low as in the community, not hospital. When you think of Kenya as a whole, think of the setup, think of the lifestyle, think of the different lifestyle. This A class, highest to the lowest, middle, and all that. They need different designs. They need to train people. The government needs to do a lot of training. The government needs to do a lot of drilling. The government needs to change a lot of conditions. The government needs to think of developing protocols. They need to think of developing community strategies for decision making, for healthcare, for emergency. They need to establish supplies for non-hospital management because now they're thinking of going community. Community is not a hospital. They need to develop, establish communication services or hotlines for case contracts because you have to be able to monitor, you have to be able to respond, you have to have triage nurses. Triage nurses are those nurses that you call on the phone. They don't even have to visit. So in community setups, they will need something like that. If they have to even think of quarantining people out of the hospitals, they have to think of buildings. In America, they had to buy hotels. When it suddenly came in, they bought motels. They thought of renting places, renting rooms. So they think of renting big hotels that are not in use, acquiring old buildings, structuring anything that they can use. So the government of Kenya could think of things like those old buildings, like an informal settlement is not possible. So you think of buying a hotel, paying it, developing strategies, conditions where people can learn, training them, breaking cultural barriers, which is such a big thing in Kenya right now, developing contracts with people that can train USAID and all these small organizations that can come and be a part of changing everything to be able to work with the COVID-19, supervising them. I mean, so many things. Policy makers, they need a lot. They need a lot. That is some of the things I can advise that can work in Kenya.
Evelyne, we cannot thank you enough for taking the time to share your story and all of the advice that you've given. I think it's brought a new perspective to the COVID struggle that we're all going through. And for me, you know, again, like we discussed on the last podcast about empathy, I think you brought a new layer of empathy here in this consideration, because when I think about those that are on the front line, you don't think of how deeply integrated they are, a part of our community. You know, you talk about stigma, going to the store wearing your scrubs and people lashing out at you because you're on the front lines as if you had a choice, you know. And I know some people have quit the healthcare industry, and I'm grateful for people like you who find a way to stick through it and muster through it, because you know the importance of it, you know, and being able to care for those patients who can't see their families, having the empathy to arrange a call, because I know that's outside of your specified duties as a nurse, but you guys go above and beyond to make sure there's, you know, care and compassion for those people who are sick, but also you're thinking about how to protect yourself, your family, and the community. And, you know, the more I hear from healthcare professionals and those that are on the line, it makes me really think of how selfish those individuals are that refuse to follow basic procedures, such as, you know, wearing a simple mask, not even a surgical medical mask, and we're wearing it for no more than an hour while we're out. But you, people like you, are wearing that for your entire shift of 12 to 15, 18 hours. You're wearing those equipment, you know. It makes it very simple in my mind that the little things that we're being asked to do, social distancing, using our mask, you know, avoiding going out as much as possible. We know people still need to work, we know people still need to get food and things like that for their family, but the, you know, the small sacrifice that we can make, it is very small in consideration to, you know, in comparison to what you and frontline people like yourself are going through, whether worldwide, really, whether in the US or back home. It's all important for everyone to do their part, you know, because it continues to raise the burden on the frontline people. The more that we don't care, we gather, and we don't take proper precautions when we do gather, it puts more strain on not just the healthcare system. Because again, people hear healthcare system, they hear government, and they think of this entity. But those entities are made up of people who have family members who are part of communities, you know, and so it comes back to us. As much as we think it's just this thing that's out there, it comes back to us, you know, whether it's our mother, it's our kids, it's our teachers, our community, everybody's affected by this. And so I hope anybody that's listening to this will take it seriously about helping to stop the spread as much as possible. We can all do our little part to make sure that it doesn't spread worse and make things heavier for others. So I want to thank you for taking the time to share your story with us and your perspective. And I hope that it's helpful for other people who are listening and maybe take the right steps moving forward.
Right, right. And on that note, Evelyne, definitely thank you for all that you are doing.
Mm-hmm. Yes.
There's no way to really emphasize that.
Yeah.
And, you know, for that person who might be listening to this and wherever they are, and they're scared, they're worried, there are all these different emotions. What's your elevator speech to them? What's your message of hope to that person?
My message of hope to that person is keep fighting. You can do it. Take care of yourself, number one. Because if you don't take care of yourself, you cannot take care of somebody else. Gown up as much as possible. Just know that you're making a difference in somebody else. Your joy is to see people recover. The joy is to see that somebody got out of it. You can only do so much. Do not think that you cannot do it. You can do it. Dress up, gown up, smile when you get home, unwind, think positive, talk to your friends, talk to family members, have a strategy to unwind. That gets you going the next day. Drink a lot of water. Don't be fearful, but when you're fearful, because it's part of nature, shift your mind. It's scary when you hear a coworker died. The next thing you think is, I'm gonna be the one who's gonna die. But the thing that kept me going is, as long as I cover myself from head to toe, I will be fine. Because I know one of the careless things we do is you get tired and you just say, oh, I can't breathe, and you take it out. And that 1, 2, 3, 4 minutes without social distancing and not having it on is what puts us in danger. I know sometimes we can't avoid it. I know sometimes we can't avoid touching your nose, but the message of hope is you changed a life. Somebody made it. What you cannot do, don't worry about it. What you can do, do it. Pray, Think of your family, think of your friends, think of the people out there. For my country, Kenya, I know the biggest challenge in Kenya is our weak healthcare system. If we can focus on this, building better infrastructure in Kenya, this will help us a lot. If you think about Kenya, my gosh, we only have 2% of the world's doctors, yet it's one quarter of the global diseases are in Kenya. If we can get sustainable investment, that can take us a long way. If we can think of digital technologies, that can take us a long way. If we can think of improving knowledge, skills, and resources for those who need them, that will take us a long way. If we can manage our resources well and accountability, that will take us a long way. If we can have training on how to manage high acuity patients, that will take us a long way. If we can repair our infrastructures, that will take us a long way. There's an energy that gets us moving. There's an energy that takes us moving. Anytime we see things are in order, we are never perfect, but when we have a working system, that is hope too. A working system is also hope. I think the hope that we had was that the system we were going to was working, even though sometimes we lacked the gear, but the system was working. The support from the doctors, the support from other people, just hearing that people are clapping, just seeing that people can come on the streets and just hit their garbage, their cans, their cups, just making a noise and cheering. That was hope. Our fellow Kenyans, cheer our nurses, love them, praise them, give them incentives. That is hope for them.
Join us for the next episode of All Things Africa with Levy, Mike, and Linda. To get instant notifications on new episodes, subscribe to our podcast wherever you listen to our podcast, or find us on Anchor at anchor.fm/allthingsafrica. Follow us on Twitter and keep the conversation going with the hashtag AllThingsAfrica.